Hello, welcome to Polaris Sendias. We support children, young people and their parents and carers in Hampshire, on the Isle of Wight and in the London boroughs of Richmond and Kingston. I'm going to talk to you today about phase transfers for children and young people with education, health and care plans. We'll look at the process, who's responsible for doing what and what timescales are involved. If your child has an education, health and care plan, you may have heard the term phase transfer and wondered what it's all about. A phase of education is also known as a key stage, so there are four. Key stage 1 is from year R to year 2, key stage 2 is from year 3 to year 6, key stage 3 is from year 6, and key stage 4 is from post 16 onwards, or sometimes called year 12. Phase transfer is the transfer that happens when a child moves from one of those key stages to another, and it often involves moving from one setting to another. So for instance, from early years into infant school, from infant school into junior school, or from junior or primary school into secondary school, or from secondary school onto college. An education, health and care plan annual review that takes place in the 12 months leading up to the phase transfer is sometimes called a phase transfer review. It should follow the same process as the annual review does every year, but at a phase transfer, your child has reached an academic milestone, so it's an especially good opportunity to reflect on the outcomes that are in your child's education, health and care plan, and whether they've made progress towards them, whether they've achieved them, and whether new outcomes need to be set. It's also a good opportunity to look at whether or not the information in the plan is still up to date. So your child may have been much younger when the plan was initially written, and it may need to be updated to reflect their maturity level now, or any needs that have changed, or new needs that have come to light since the plan was originally written. During the phase transfer annual review, it's also a time to discuss and decide on which setting your child will go to for their next phase of education. As with the Education, Health and Care Plan annual review that takes place every year, the local authority has to start the review process by asking the young person, their parents, teachers and anyone else involved in their support for their views on the child's progress. That job's often delegated to the school, and it's up to them to ask everyone to contribute their views and to attend a meeting. They have to invite the people to the meeting and give them 2 weeks' notice so that any information that is sent in can be circulated and read. The review process in full should be completed within 8 weeks, and if you want to look at the review process in more detail, you can pause on this slide. Bearing in mind that the review process takes up to 8 weeks, it's very important for children who are coming up to a phase transfer that the review process begins before the end of the autumn term in the year before they're due to transfer, because there are national deadlines by which the local authority has to finish the phase transfer for all those children who are due to change phases of education. So children in key stage 1, 2 and 3 have to have their phase transfers completed by a deadline of the 15th of February in the year they're due to transfer. And those children moving from key stage 3 into 4, so onto post 16 or college, have to have their phase transfers completed by the 31st of March. If the process doesn't start before the end of the autumn term, it won't be completed appropriately by the 15th of February. As a young person or parent, you should always be fully involved in the review process, and there are some key tips to help you prepare. It might sound very obvious, but reread the Education, Health and Care Plan. It might be quite a few years since it was first written, and it's important to go back and remind yourself of what it says and to think about whether or not it's up to date enough for your child moving into a new setting or a new phase of education. If you think your child's needs have changed a lot, or if you think the information that the plan is based on is out of date, it's really important to speak to your local authority as soon as possible and ask them to arrange up-to-date assessments or up-to-date advice from professionals that can be provided before the review meeting takes place, so that that can be taken into account when you're discussing any changes that might be needed to the education, health and care plan. There's also the time as a parent or as a young person to visit the settings that you're considering for the next phase of education. And when you visit the settings, we'd really encourage you to meet with the SENCOs and talk to them about your child. Ideally, introduce them to your child if they can be there for that. And talk to them about whether or not they think they can meet your child's needs. What sort of setting does your child need? What sort of expertise do the people who teach them need to have? And if there are concerns about whether or not that setting could meet need, what things could be done to overcome those concerns so that you can rule in and rule out different types of settings. Even if you are fairly certain that you want your child to go to a special school setting, we would always encourage you to visit the local mainstream setting so that you can form an informed opinion on the reasons that it is or isn't suitable for your child. Whilst you're at any setting, whether it's mainstream or special school, it's important to ask the school about the peer group that your child would have to see whether or not they will have social peers and academic peers in that setting. After the phase transfer review's been completed, so by the 15th of February or the 31st of March, the local authority has to issue an amended education, health and care plan. Section I has to name the setting or type of setting that the child or young person will attend from the start of the next academic year. And the local authority must inform you in a decision letter that goes with that plan of your right to appeal if you disagree with the setting that's been named or the contents of the plan. Every year we advise lots of families who are working through this process with their children, and these are the questions that we're asked most frequently. So what if the review doesn't happen on time, or what if you don't get a decision later by the 15th of February or the 31st of March? So in the first instance, you should raise your concerns about that with your SEN caseworker straight away. And if there's no response or your concerns aren't dealt with quickly, you can escalate to their manager and you can find out who the manager is through the local authority, or if you are having any difficulty doing that, you can contact us. That's an informal way of addressing your concerns, but is usually the quickest. If you are unsuccessful with raising your concern informally, you can access the formal complaints process that each authority has, and we can give you advice on how to find that. It's available on all of the local authority websites. Lots of parents ask us, where can I get a list of schools to consider? Because maybe you know those that are local to you, but want to make sure that you haven't missed any or consider some that are further afield. There are some links on this slide that you can follow to each local authority area's school lists. It doesn't include independent settings, but those are readily available online. And again, if you have any problems finding them, you can contact us. And then what to do if you disagree with the setting that's named. And very similarly to my comments on the earlier slide, in the first instance, we would always say meet with the setting that's been named and discuss with them whether they think they can meet need, because they may be able to alleviate your concerns. And if they can't, they should be able to help you frame your reasons for feeling that the setting isn't appropriate, and should be able to give you pinpoint things within the education, health and care plan that they don't think they're going to be able to do that shows that that setting isn't appropriate. If you can't overcome those barriers and you are not satisfied that your child's needs would be met in that setting, then you do have a right to mediation and appeal. And we have lots of information across our websites about how to do that. We also provide ongoing advice through our telephone helplines and email addresses. Here we've got all of the links to our contact pages, our websites, our email addresses and phone numbers, depending on which area you're from, and also a QR code. If you have time, please scan. Tell us what you find useful about this, what would be more helpful to include, and anything else that you think we should add to our YouTube pages or information. Thank you for listening.